Guys, I've been asked to comment on the role of Sculptra as a filler versus other fillers. And the real question is, what is Sculptra? Is it really a filler? And how does it compare to other traditional fillers that we have? So one of the first fillers that actually came to market in the United States was Restylane. And so Restylane has been around since 2002 as an FDA-approved filler and replaced an old generation of fillers called collagen. So we used to inject actually collagen, whether the collagen was derived from humans or from bovine or from cows. And so the reason collagen was replaced by Restylane, because collagen only lasted up to 3 months. It was so short-lived that the body actually got rid of injected collagen. And so Restylane was the first filler that became available in the United States, and the composition was different. It's made of hyaluronic acid. Many of you guys know what hyaluronic acid is. It's a natural carbohydrate that's found in our skin and our joints. It serves as a lubricant, but it's also a very nice filler. So hyaluronic acid is actually found in some skincare products, but our main use in cosmetic dermatology is through fillers. And so here is what Radiesse looks like, and as you can see, it's a clear gel. It's a gel-like substance, and that's why it's used as a lubricant. So Restylane is a nice filler. It's a subtle filler. I like using Restylane under the eyes. I like using it in the lips. So it does nice soft correction. Another filler that's hyaluronic acid, for example, there's many of these hyaluronic acid fillers, is Juvederm or Juvederm Velour. Again, as you can see, it's a clear substance, it's a gel-like substance, and again, this is injected in various areas like lines or under the eyes or lip lines or as a lip filler, and again, it's clear, hyaluronic acid filler. Now, we can talk about a different filler which is thicker. It's called Radiesse, and Radiesse is different. The color, it's white, and the color of Radiesse is white because it's got calcium hydroxyapatite in it. Calcium is white, as you can see. It's a much thicker substance. It's toothpaste-like. This high viscosity actually is useful because we can use it in areas where we need structural change. Those areas include the chin or the nose or the jawline where we want to create a more defined jawline. Now, some people also consider Radiesse as a biostimulator because it's postulated that the calcium granules here serve as a stimulus for production of new collagen or new skin in the dermis. And so this can also be diluted. Radiesse, they call that hyperdilute Radiesse. And hyperdilute Radiesse is used in injections in the hands or injections in the chest area, décolleté, for rejuvenation. Now, similar to Radiesse, Sculptra is a biostimulator, but Sculptra is not for focal injections. It's not for creating contours, or it's not meant for really to inject in a precise area to cause a lift. Sculptra, when it was first introduced, and as you can see, Sculptra is a powder. This powder is very akin to suture material. It's actually minced suture material. And so it's supposed to be actually reconstituted with bacteriostatic water. It's poly-L-lactic acid. And so we constitute it with bacteriostatic water to make a suspension. And so when we have this suspension, it's used as a biostimulator, but the original use of Sculptra was FDA approved for a condition called HIV lipodystrophy, where HIV positive patients who take an anti-HIV medications become extremely hollow or gaunt. And the first use of this was to build volume in patients with HIV lipodystrophy. And from then on, it actually gained the indication to be used for cosmetic reasons to build up faces for pan-volume facial augmentation. So my ideal use of Sculptra for me is somebody who's hollow, somebody who's older, who's hollow, who wants to build their face up gradually because they're very gaunt, and it usually takes injections once a month. You can take 3 to 5 sessions of these injections. And immediately after we inject Sculptra, the water goes away, and then you're left with these powder granules inside your skin and the dermis, which serves as a stimulant for new collagen production to cause collagen remodeling slowly over time in a natural manner. Now, the latest approval for Sculptra was actually for skin texture. And I just wanted to show you is that when we reconstitute the powder with bacteriostatic water, it looks like this white suspension. So we actually take this white suspension, we draw it into syringes, and we inject it back into the face. But I was going to say the latest indication for Sculptra has been for texture improvement. So the FDA recently approved Sculptra through FDA clinical trials to actually give them the indication if you want textural improvement, you can use Sculptra, and that can be used in young patients as well for improvement of texture, both in the face or texture in the neck. You may have seen me use Sculptra off-label in many other areas. I've used it, I've had videos showing you guys Sculptra injection in the knees to make kind of knee wrinkles better, or Sculptra in the buttocks to create more volume in the buttocks, as well as inject into the face for panfacial volume augmentation. So again, just to reiterate, I think that our understanding is that, at least my understanding, the way I use it in my practice is that I like to use focal fillers like Radius, like Juvederm, like Restylane hyaluronic acid fillers for focal augmentation of very specific areas where we want to balance those areas, where we want to get rid of wrinkles or lines or depressions, for example, around the eyes, or building cheeks, or creating a more defined chin or jawline, or getting rid of wrinkles around the mouth. Whereas Sculptra is really for more injections into the entire face in the large surface area to gradually build volume over time. So it's really used in a different fashion. I hope that this video will help you understand the differences between biostimulators and focal fillers, and so that you can choose the right filler for the right indication, for the right anatomic area in pursuit of your cosmetic goals. Dr. Cameron Rockstar.